Honorable Speaker of Bangladesh National Parliament to deliver her speech.
It is a great pleasure and a very special privilege for me to be here this afternoon, attending the first International Breast Disease Congress inaugural session at Bangabandhu Sheikh Mujib Medical University, organized by the Association of Breast Surgeons of Bangladesh. Honorable Chair, Professor Saifuddin Ahmed, Honorable Special Guest, Honorable State Minister, Mr. Zahid Malik, MP, Ministry of Health and Family Welfare, Honorable Vice Chancellor, Professor Dr. Kamrul Hassan Khan, Pro VC Professor Dr. Mohammad Sharfuddin Ahmed, all the very distinguished and esteemed breast surgeons, faculty members from abroad attending this 2-day-long seminar in Bangladesh, the breast surgeons from Bangladesh, including the women surgeons who have come from different parts of Bangladesh to take part in this 2-day-long very important seminar, the medical practitioners, doctors, nurses, and all others involved with Bangabandhu Sheikh Mujib Medical University, respected guests, media representatives, a very good afternoon to you all. It is a very important event, and I am very honored and pleased to be invited here to have the opportunity to learn and understand a bit more about this very specialized area on which the focus is being given in this 2-day-long seminar. I want to congratulate the Association of Breast Surgeons of Bangladesh for organizing the first International Congress on Breast Disease. I think it is a very important initiative, and as we can understand that it has its focus not only on breast cancer, but the focus is wider. It involves all different kinds of breast disease, but of course breast cancer is one of the most threatening ones among those. As I mentioned, that it is of course a very specialized area, and it concerns largely women who are inflicted or affected by this. So it is a very good initiative that we have a separate association focused in this area, and it comprises of the breast surgeons, very renowned breast surgeons of Bangladesh. On the other hand, I take this opportunity to thank the Honorable Vice Chancellor of BSMMU, the Pro Vice Chancellor, and the rest of the team of BSMMU for the support extended by them to this great cause. I thank the faculty members, the breast surgeons and doctors who have traveled a long way from United Kingdom, India, UAE, as I am told. They are all here to join this 2-day-long seminar in the midst of their very busy schedule. So I welcome them to Bangladesh, and I thank them for being here to share their expertise, their knowledge. And I feel that it is a task that needs a lot of team effort, because Nowadays, we live in a globalized world where this interaction between different nations is a point of strength for us. So it is a mutually learning experience, and we, through our own knowledge and expertise and through this mutual exchange, can have a benefit that we cannot do alone. So having an international forum gives the opportunity for the specialized practitioners to meet, maybe annually or after a certain point of time, in different countries, to strengthen this network, and at the end of the day, it is for the benefit of the people. We all strive, the government, the private sector, whoever are working in this area, particularly in the health sector, for ensuring not only the longevity, not only a long life to the people, but also to ensure a healthy life, a quality life, which is so important. And with the progress of the medical science these days, with every day new and different innovations, now so many things are preventable. If breast cancer was not something that was preventable, then it would be something else. But we know that our efforts and our timely efforts can save so many lives. So when it is preventable, nowadays the medical science is also giving a lot of stress in trying to publicize and trying to share this knowledge that so many diseases are preventable. And that is very important, because if we can save lives by giving out the right information, the right awareness to the people, and not only awareness but also access to the health system from where they can actually get the benefit and how we can help them, then we can save so many lives. And when we save lives, it is not individual life, but it is also the family and the society, and it is of course for a much greater cause. I am happy to share the success stories in the health sector of Bangladesh, as some of the very important indicators have been mentioned by our Honorable State Minister for Health, because they are the ones who have been working relentlessly to promote the health sector, to make health and make the treatment more affordable, more accessible for the people of this country. Honorable Prime Minister Sheikh Hasina's vision of creating the community clinic. Now we have 13,000 community clinics throughout Bangladesh in different rural areas, which takes this health facility to the doorstep of the people of the country. It is very important to raise the awareness, and I feel that this Breast Surgeon Association can be very effective to team up with our members of parliament and go throughout the country to different parts, to rural areas, to raise this awareness among people as to what they need to do, how they can have this checkup, from where they can get the treatment, and how cost effective can we make it. So these are the areas, because most of the time women, they do everything for others. They are the caregivers, but they don't have enough time to take care of themselves. So sometimes it is they neglect themselves and there's nobody else to point out. So we need to make them more aware. We need to make in general everybody more aware of this particular very serious disease of breast cancer. And if the women are told and they understand and they can, ensure their checkup, timely checkup, to assess if there is any risk, then, and if there is any, in the initial diagnosis, if there is any risk, then that can be taken care of. But women are generally very shy, they're hesitant, and they feel that so many other things are more important, so sometimes they neglect. We need to create a lot of awareness through the educational institutions for young girls, and even through courtyard meetings and other different ways. Nowadays, media plays a very important role in mobilizing public opinion. So we can use the media, and this is Digital Bangladesh. So the networking is spread out throughout the country. It is very easy comparatively now to have access to people and to disseminate information. So I feel that the Breast Surgeons Association can play a very important and vital role by teaming up with different segments of the society to encourage women to have timely checkups and to see if there is any danger. And if there is, then what to do. That guideline should also be given to them, because without that they will not know where to go and how to seek the help. I congratulate the doctors who are very dedicated and committed to this cause, which is a specialized area, I repeat time and again, and it is only through their expertise, their knowledge sharing, their commitment and service that we can really bring about a change in the nation by reducing the number of deaths through breast cancer. And I think that is the mission that we would all like to pursue. And particularly, I congratulate the International Congress of coming together, because I think it is a very fruitful endeavor to share knowledge in this society where we live now, in this globalized world, because there's so many innovations taking place every day. New knowledge, new medical science development is there, and only through this international congress can we make the best use of this extremely valuable resource pool that we have in this world. So I'm very happy that Bangladesh Breast Surgeon Association is a body which not only works within the country but also connects with the wider world to have a more comprehensive understanding about this very specialized area. I extend my full support to this cause and will be very happy if there is any way we can assist in taking forward your agenda of serving the women of Bangladesh and also the women of the world. So let us all unite together from wherever we are to take this cause, which is a very noble cause, to prevent deaths through breast disease or, for that matter, any other disease, and to ensure a quality and a healthy life for all our people. Thank you, ladies and gentlemen.
I have the privilege to thank the Honorable Speaker for her kind words of inspiration. Now, the crest will be handed over. The Honorable Chief Guest, the Speaker, Dr. Shirin Sharmin Chaudhuri, will receive the crest from the Honorable Vice Chancellor, Professor Kamrul Hassan. Now, the Honorable State Minister of Ministry of Health and Family Welfare, Dr. Jahid Malik MP, will receive the crest from the President of ABSP, Professor Saifuddin Ahmed.